Before I get to questions, let me see that shot. You've got your, this is our shot. You're part of this campaign, are you, to remind us to get out there and be vaccinated?
That's right, for everyone to become a vaccine champion in this movement of vaccine confidence. This is our shot, Canada.
That is fantastic. Lots of well-known Canadians driving people to hashtag This Is Our Shot to find out more. So thank you. You'll remind us throughout our conversation this morning. I want to get to viewer questions, and I want most of it to hinge on Johnson & Johnson, because we'll keep coming back to those pictures, those first doses arriving in Canada. Canada now with a fourth vaccine. But I was wondering if we could begin with your thoughts on what makes this particular vaccine different and where you see it's being most useful or applicable.
Yeah, so this vaccine is also a viral vector platform vaccine, somewhat similar to the AstraZeneca type of vaccine. And again, as you mentioned earlier, the big advantage of this vaccine is that it doesn't need ultra cold storage temperatures. It can actually be in a regular fridge for up to 3 months, which is a huge difference compared to the mRNA vaccine. And again, it's only a one-dose vaccine, so it is all about accessibility. So this vaccine can be used in those areas where accessibility is an issue, and we know from already some of our vaccine rollout statistics that we are seeing a lot of inequity in terms of accessibility. So this hopefully addresses some of those issues.
One of the things we know about the J&J, the Janssen vaccine, is the labeling. Health Canada's wanted the labeling change to reflect the blood clots that have been linked to this vaccine, the extremely rare side effects, similar to what we've talked about with AstraZeneca. Just a point from you on that as well, so people can understand what is an extremely rare side effect.
Exactly. So similar mechanism believed to be behind the side effect, this immune response whereby post-vaccine people have some antibodies develop to factor on their platelets that activates the platelets, get them clotting, so having clots, while at the same time, these people have low platelets. So it's a phenomenon of low platelets and yet having blood clots, and the same kind of warnings about what to watch for, as we talked about in the AstraZeneca vaccine, the headache, feeling unwell, particularly chest pain, swelling in the limbs, rashes, especially around that 4 to 5 day period after the vaccine, till about day 20 to 24 past the vaccine. And again, and you know, some of the controversies and some of the stop and go parts of the vaccine in the US. And this is what has come out of that. Similar mechanism, similar time frame post, and similar warnings in terms of what to watch out for patients, people who've had the vaccine.
Okay. Thank you again for clarifying that. We do have some viewer questions about side effects. Let's begin with Raj, wondering again, if you look at the side effects of the J&J vaccine and also of the AstraZeneca, Raj is wondering, how would that compare to severe side effects of a normal flu shot?
Yeah, so the one thing I want to say about this is that these vaccines and side effects of these vaccines are studied extremely carefully, and all side effects are reported of these vaccines, whereas that's not always the case with some of the other already licensed vaccines. So take fever, for example, after a flu shot, that's not a reportable side effect, whereas for these vaccines, they've looked at all these kind of effects. So we do know that if it depends a bit on what type of severe side effect you're looking at. If you're going to look at some of the quite severe ones, like let's say anaphylaxis, we know that anaphylaxis with a flu shot is about 1 in a million. We know that with some of these other vaccines, especially the mRNA vaccines, can be 4 in a million. Again, back to fever, that seems to be very low incidence post-flu shot, for example, a lot higher with some of these vaccines. We're looking in the maybe 20 to 30% rates, especially after second dose vaccine. So after you've had a second dose of an mRNA, AstraZeneca vaccine. And for sure, we're seeing some of that with the Johnson & Johnson as well. And again, this vaccine-induced rare clots that can happen seem to be somewhat specific to the Johnson & Johnson and AstraZeneca vaccines.
Okay, thank you. So similar symptoms, but maybe a little bit more pronounced in conjunction with the COVID vaccines. And again, you've laid out what you should be watching for in the most rare and most serious of those side effects. Similar to that, you were mentioning with the clotting issue, low platelets comes into play. And Manuel is wondering, for the AstraZeneca and the J&J shot, why not do blood platelet tests beforehand to find out if the person needs a different type of vaccine?
Yeah, so it's a good question, and a lot of people are looking at this kind of approach. Can we do something beforehand to predict who's going to get it? The problem is right now we cannot really predict who is going to get this kind of reaction over other people. And by the time this process starts, it's actually an immune process. So you're going to have the antibodies before you have the low platelets. Therefore, that's a much later effect. And by the time you get there, you would see some kind of clinical symptoms as well, which is why we'd rather people watch for that first, because the low platelets is an after. At that point, this whole mechanism is already in action.
Okay. A couple of questions from Janet and Sarah, and they come back to something that you and I were talking about. And look, I'm still carrying my low-dose aspirin because my mother told me to, even though you told me I don't need to. But both Janet and Sarah were wondering, again, to minimize this risk of blood clots, should we take a low-dose aspirin? I'm wondering why doctors aren't recommending. Can you just go over your message on that and the important thing we need to know about why we don't really need to have this?
Yeah, and I tell you, I've talked to my hematology friend about this because I wanted to make sure that I understand why such recommendations are not made. And there's two things to it. So first, the mechanism, by the time this mechanism is started, aspirin is not going to make a difference. So you actually need an antibody to the antibody and a much more significant blood thinner to once this mechanism has started. So it wouldn't really help post this effect. Before the effect, so in a preventative fashion, again, this is immune mediated. So some aspirin every day is not going to stop that immune process. And any such medications like aspirin come with their own side effects. And if we put everybody who got these vaccines on aspirin, we would have way more severe side effects, such as bleeding from aspirin, than we would actually have vaccine effect.
Okay. Thank you. One quick last question. We got this on email. This is about AstraZeneca. Someone who had severe body aches, pains, fever, nausea, fatigue, all the side effects that you laid out, still fatigued, as a matter of fact, and now is worried about getting the second shot. We know some people aren't going for the second shot. We're hearing reports of that. What do you want to say to someone who maybe doesn't want to go through it again and reluctant to get that second dose? Your immune system has had a brisk response. So you've had quite a response to this vaccine. In some ways, it's a good thing because it shows that your immune system has seen it and is ready to actually build immunity to the vaccine. We do see more side effects on the second time around because the immune system is even more primed. However, I just want to say it's all about putting it into perspective. Yes, fatigue, headache, fever, it's a problem post the vaccine, and I see how that affects people's lives. But COVID would in a so much worse way. And we know that this particular vaccine, you would still get better protection after that second dose. So you're almost there. And if you need to take some pain medications, do that, but go for your second shot when that's being offered. Dr. Cora Constantinescu, thank you very much.
Thank you. Have a nice day.